Hi doctor, can you please explain all you need to know about breast cancer surgery?
To understand breast cancer surgery, we can simplify it by dividing it into three things. One, how are we going to address the primary tumor? Two, how are we going to address the axilla? And three, do we need any kind of reconstruction or not? So if for the primary, I would say you should discuss with the doctor and take the decision. The two common ways to deal the primary, that is the breast area, is either complete removal of breast or by going for a breast conservation surgery. So this decision depends on various topics like what is the size of the tumor, what is the age, and how big the tumor is in comparison to the breast, and which part of the breast the lump or the cancer is located. So various factors are involved in this. So you need to discuss it in detail, and along with the discussion with the doctor, the patient also should actively participate in making a decision for the how we are going to address the primary. Coming to the axilla, the clinician is the best person to decide how we are going to address the axilla. There are two ways to address the axilla. In olden days, we used to do axillary lymph node dissection. That is removal of the lymph nodes from level 1, 2 and 3. As and when required, most commonly we remove level 1 and 2 group of lymph nodes, but it is associated with a common complication, that is the lymphedema. So the latest technology is by doing a sentinel lymph node biopsy, where we inject small amount of dye in the nipple areola complex and we track this dye to the first group of lymph nodes in the axilla. These first group of lymph nodes will be dissected without disturbing the other part of the lymph nodes, and these lymph nodes will be examined under the microscope when the patient is undergoing the surgery. This report we get within half an hour of time, and if the lymph nodes are not involved, then we are not going to disturb any lymphatics in the axilla. Whereas if the lymph nodes are involved, then in such cases we are going to further proceed and finish off a complete axillary lymph node dissection. Basically, by doing sentinel lymph node biopsy, we are trying to avoid the important complication, that is the lymphedema of the arm. And the third important step of understanding breast surgery is if there is any need of reconstruction. If you are doing a breast conservating surgery, most of the time we do type 1 mammoplasty or type 2 mammoplasty, where we will be mobilizing a fat from other parts of the breast so that we give the proper contour and all for the breast. Whereas if complete mastectomy is done, then you need to discuss the reconstructive options, where you can just opt for an external prosthesis if needed, and the other reconstruction options are you can consider for a Latissimus dorsi flap, or you can consider for a tram flap, where we will be taking a part of tissue from the abdomen and will be placing near the breast area and try to match it with the size of the opposite breast. So the patient should understand three things basically, that is the how we are going to address the primary, how we are going to address the axilla, and if there are any reconstruction options available for you. Thank you.